Hello guys, good afternoon. Welcome back to my channel. My name is Ayosimi and it's a big pleasure to have you on this channel. For those of you who are here for the first time, guys, thank you for coming. Please like, subscribe and share the comment and the channel link. Also comment on the channel, comment on the videos. Let me know that you are there. Thank you for coming. And for those of you who are returning subscribers, guys, you don't know how much I love you. Thank you for coming. Thank you for always turning up for Ayo seeing me. Thank you. I appreciate you. And guess what? I don't take you for granted. So this afternoon, I have come to continue on the pregnancy series. Probably going to be the last video in the pregnancy series. Unless something else comes up, I plan for this to be the last video on the pregnancy series. And it is something very, very important that I'm going to talk about. Something important, something you cannot, overlook in pregnancy. And that is mental health and depression in pregnancy. So I want you to sit tight and I'll see you after the break. Welcome back, guys. Like I said, this series is going to probably and possibly be ending with mental health in pregnancy. So today I'm going to be talking about mental health and depression in pregnancy. Now, I want you guys to know this fact, and it is very important. Mental health changes in pregnancy. Pregnancy can affect any part of a woman's body. Hormones can lead to the woman feeling sad all the time, low sex drive, low food drive. Pregnancy can affect any and every part of the woman's anatomy and physiology. And I'm talking about the physical structure of the woman and the functional structure of the woman's body. These can get affected with pregnancy. So, as partners, as family and friends, look out for some of these things and help them to safely maneuver this very sensitive period of their lives. So, pregnancy is a big event. It's a big life event, and it can affect any aspect of the woman's body structure and body function. There are things that you can do to help a pregnant woman maintain their mental health. If you realize, the first thing is to be observant. And we as pregnant women too, we need to also be observant. If you're pregnant, just observe things about yourself. The first one is, if you feel that your mood is unnecessarily or is uneventfully low, if your mood is very low and it is unprecedented for you, because we all know ourselves. Some people, even without pregnancy, they're like that. But if you know that being pregnant, that you are just so low in your mood, you should then talk to somebody. Start with your partner. Talk with them. See if there is anything around you that is causing this. See if there are factors around you that is actually causing this. And if there is anything you guys can change or move around to assist you to have a better outcome. But if you realize that you've done whatever you could have done and nothing is changing or nothing has changed, then you need to talk to a doctor or a midwife. You can try all these, this yoga, calming breathing exercises. Sometimes light exercises can help improve your mood in pregnancy. I can attest to that. Light exercises. Look for light ones, all these breathing exercises, music, just look for what works for you. Try, move things around, think things through with your friends, with your family members, with your husband, with your partner, and see if that helps. Now, I did an earlier video in this pregnancy series talking about eating healthy, taking the right supplements, and all that. You know, that may also help. If your diet is balanced and you are healthy and your baby is healthy, that will go a long way in improving, in helping your mood if you're pregnant. Then, see, another thing that is very important, pregnant women, is to actually associate with other pregnant women. And that's why your antenatal classes are very, very important. Going for your antenatal classes can help you when you see other pregnant women, when you hear some experiences, when you say, oh, do you know that in the past 2 days, I've not been able to keep anything down. And someone will be there to tell you, oh, yours is 2 days. Okay. Me, in the past 2 months, I've not even been able to. And then you're like, oh, so so I'm even still much better than you. So when you talk with other pregnant women, when you socialize with them, when you guys have a good chat together, it helps you. It helps to lift your mood and keep your mood healthy. Now, these are the things you must not do. Because you're feeling low, 3 things you must not do. First, you must not compare yourself to others and say, oh, see, this person is 9 months pregnant. See how good she looks. See how her skin is. See how her face is. See how her bum bum is just right. See how her legs are just straight. Or see, she's just very happy. No, don't compare yourself with others. Let me tell you, if you get pregnant 3 times, you are going to have 3 different experiences. So, unless you want to start comparing yourself with yourself, there is no point comparing yourself with other people. Secondly, don't be afraid to tell professionals. If you feel that you are struggling, you are really, really struggling with your mood, with your mental health, if you are feeling pressure and all that, I would advise you, don't be afraid to go and tell doctors. Don't be afraid to book a GP appointment. Your GP, your consultant, your midwife, don't be afraid to tell them exactly what you are feeling. Don't say that, oh, it's not supposed to. The way you are feeling is what determines what is supposed to be and what is not supposed to be. So don't be afraid. Go to them, pour out your heart to them. They are there to listen. And that's the best way for them to actually help you to have a very good outcome. The third thing, don't go and use alcohol or drugs to say, no, I want to improve, I want to lift my mood. So you go and take Hennessy, go and be taking alcohol. No, 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 no. Alcohol is wrong. Don't take alcohol in pregnancy. Avoid it at all costs. And it's not because of just you, it's because of your baby. You want that baby. What's the point of going through pregnancy for 9 months and then having a baby that is not healthy? What's the point? If you can avoid it, avoid unhealthy babies. If your baby is not healthy, don't let it be from your own actions or inactions. Do your best to have a healthy baby. If you have not done your best and the baby comes out with one abnormality or the other, you will know that you have done your best as a woman. And then you love the child the way the child is. But you don't want to have a child when you have taken all the booze, all the alcohol, all the drugs, and then when the baby comes out, you see how the baby is, and you don't want to start blaming yourself for the rest of your life. So please, don't use alcohol or drugs to kill or to lift your mood. No, seek professional help. If you have done your best and your mood is still not, if your mood is still not lifted, seek professional help. Things you want to talk about is you tell your doctors what you have done. See, I started feeling like this on so date or around so period. I tried this, but it didn't work. Then your doctors will determine if you need further help. They can they can refer you to professional counseling services. They can refer you for cognitive behavioral therapy. They can refer you, for other types of professional services. If you still go for those and they don't help, then you may have to take medications. The doctors will know the right medication for you to take, considering your pregnancy and the right dosage. So, mental health in pregnancy is not something to be ashamed about. No, it's not something to feel ashamed or, it's not something to feel ashamed or self-conscious about. You didn't make yourself like that. Pregnancy has just dealt with you, which is fine. Like I said in the earlier videos, you're sacrificing a lot to have your baby. So it is your job to take care of yourself. There is one very common mental health disorder that people present with a lot, that is very common with pregnancy, and that is antenatal depression. Antenatal depression happens when you realize that you have low mood that is not being alleviated, that nothing is helping with. When you have that, when you find out that you are you have your mood is just low and nothing is helping with it, you may have antenatal depression. Now, what are the symptoms of antenatal depression? Now, see, some mood changes are normal in pregnancy. It's not all mood changes. Pregnancy itself can change. In fact, pregnancy is a mood changer, regardless. So that one, mood changes and pregnancy, they are 5 and 6. But when you realize that you are feeling sad, you have low mood, you are tearful, like you are crying, nothing is happening to you, nobody is doing anything wrong to you or anything bad to you. There is food, there is everything, but you just feel that your mood is low, you are crying, you are tearful. Then when you see that, you may start, considering that maybe you are experiencing antenatal depression. Now, another thing is, if you are feeling irritable or you are getting angry easily, any little thing, when wind blows, you are angry. When wind refuses to blow, you are angry. Someone passes by, you are irritable. Those things. When they are happening, when you are losing interest in everything that is happening around you. TV is going on, you are not interested. Books, you are not interested. And people are chatting to each other, you are not interested. Shopping, you are not interested. Nothing interests you. When that happens to you, then start considering the possibility of antenatal depression. Another symptom, when you now collect them together, when you put them together, another symptom is when you are not eating at all. There's no food they bring to you that you want to eat. Everything just irritates you. You don't want, like, it's not as if you eat it, you will vomit. No, that's different. But you are just not interested in any food. Or it may be the opposite. For some people, they see this one they eat, they see this one they eat, they see this one they eat, this, and they cannot control themselves. Eating more than, then you may be having antenatal depression. If you're having negative thoughts of, hey, I don't think I can give birth to my baby. I think something bad will happen to my baby. Negative thoughts of, if I have the baby, I don't think I'll be able to look after the baby. Or, I don't think I can carry this pregnancy to term. If you are having that negative thought, you may be experiencing antenatal depression. If you're having a feeling of guilt, overwhelming feeling of guilt, baseless guilt, or exaggerated guilt, then you may be experiencing antenatal depression. Two major symptoms that if you have, you should immediately go and see your GP. It is considered an emergency. Is when you start hearing things or you start seeing things that are not real. You start having hallucinations, or you start sharing beliefs that are not also realistic and are not real. Then you may be having delusions. So once you start having hallucinations and delusions, they are emergencies. You need to see your GPs immediately. If you feel that there is a danger, you may harm yourself. If there's a danger of you harming yourself, if you start having suicidal thoughts or ideations, then you should see your doctors immediately. Like I said earlier about the treatment of mental disorders in pregnancy, try all these self-help and calming treatments. Try them, see if they work for you. If they don't work for you, then you need to see your GP immediately, depending on the severity of the symptoms you are experiencing. If you see your GP, you will tell them what you have done, what you have tried, then they will tell you the best way to go about it. But my sisters and my brothers, I don't want you to think that taking medication when you are pregnant for mental health issues is something bad or is something to be self-conscious about. No, it's not. Taking medication during pregnancy, make sure the medication is prescribed by your GP. Once the medication is prescribed by your GP and you adhere to the dosage that you are given, then those medications will help you and your baby to have a healthy pregnancy. So, as much as you can, do your best to take care of yourself so that you can have a healthy pregnancy experience, so that your children can have, your babies can have a healthy experience during childbirth and even afterwards. So friends, if you are struggling with mental health in pregnancy, number one, know that mental health issues, antenatal depression, they are real and know that they are real and they are not absurd. If you are experiencing it, be strong enough to seek help. And when you're seeking help, seek help from the right avenue, from the right places. And don't use other substances like alcohol and drugs to try and suppress the problem, because you will be harming your baby in the process. If you are given medications, adhere to the dosage of the medication given to you by your doctors. If you are given other therapies, please adhere to them and be forthright, about the effect that you are getting from them. If you are not having the desired effect, then go back to your GPs and let them prescribe something else for you. So guys, please take care of your mental health before you get pregnant. Do activities, do things that would help your mental health. Stay away from alcohol and drugs. Those in themselves, they are depressants. Alcohol and drugs are depressants. So if you are getting pregnant, you're planning to get pregnant, or you're already pregnant. Stay away from them because they'll cause depression for you. They will. Stay away from smoking as much as you can. Smoking is not good for your health. It's not good for the health of your baby. These are depressants. They are known depressants. So guys, I hope you now know the things that constitute mental health problems and what you can do when you experience them or when someone around you experiences them. Thank you for coming on this channel. Thanks for sticking with me all through this pregnancy series. I hope I have given you the information you need to have a healthy pregnancy. If you have any comments, please don't hesitate to drop them in the comment section. I'll respond accordingly and as truthfully as I can. I'll respond. And please remember to subscribe, like, and share the channel with other people. Let them also benefit. First time subscribers, thank you. I appreciate you. You're welcome to this family. And for returning subscribers, I don't take your loyalty for granted. Thank you very much. And I'll see you in my next video. Bye.